role as a diabetes educator is to help patients with the tips and techniques that will help them to manage their diabetes on a day-to-day basis. Diabetes is one of the few chronic diseases that maintains a lot of self-care for the patient, both at home and at work. So it's very important for them to know the best way to manage their disease on a day-to-day basis.
To become a diabetes educator, you have to have an undergraduate degree in whatever your area of expertise is, whether it's a nurse or dietitian or family therapist. And then from there, you go on and have at least 1,000 hours of diabetes education, working with patients directly to help them and learn more about their education. And then we sit for a national exam and have to pass that in our area of expertise to be a certified diabetes educator. I have a family history of diabetes, both type 1 and type 2. So when I was going back to school to get a second undergraduate and a master's degree in nutrition, I felt like this was an area that was of interest to me that would hold my interest for many years.
I was interested in the field of education with diabetes because I live with type 1 diabetes myself. I've lived with it for 33 years. I was a kid when I was diagnosed, and midlife I decided that that's what I wanted to do, so I changed careers and pursued nursing. Went on to get my bachelor's degree in nursing and then my certified diabetes educator designation.
What I like the most about working with patients with diabetes is just the variety. I see patients that are very young, very old, from all walks of life. And no matter what age or race or walk of life that someone is from, we can develop a bond and help them in whatever way they feel like they need to pursue in helping take care of their diabetes.
I enjoy working with the patients, especially helping them better understand their condition. A lot of times when they come to the diabetes center, they may feel guilty because they now have diabetes. They may be fearful because they had a family member that had a poor experience with diabetes, and just to provide them the knowledge and education to help decrease any fear and then also any guilt that they may have.
Children also get diagnosed with diabetes. Usually in the past we've seen them diagnosed with type 1 diabetes, and type 1 is an autoimmune disorder where the body destroys the cells that make insulin. They can also develop type 2, but we predominantly see type 1. Our youngest patient has been 10 months of age, and then our oldest being diagnosed are in their young teens, even young adulthood, so 18, 19. There's not really an age limitation on when they're diagnosed with it. So the role we play in families with children that are diagnosed with type 1 diabetes is to follow them once they're released from the hospital, provide supportive education to what they've learned, and make sure they know the survival skills when they get home. They know how to test the blood sugar, they know how to give insulin. We don't just do that for our children, though. We do it for the adults that are diagnosed. We remain a support system and an education system for them over their lifespan.
The challenges that people with diabetes face have to do with partly that they can never stop thinking about their diabetes. It's always in front of them. They always have to think about what their blood sugar is at the particular time. When it comes to meal times, thinking about the foods that are available, what can they eat, what are they going to have to kind of forego. So they're always having to think about their diabetes, and that can get very taxing over time, as you can imagine.
One of the things that we work so well with in this environment here at the Diabetes Center and Metabolic Health Center is that we work in a collaborative approach, and so we work as teams with nurses, dietitians. We also communicate quite a bit with the physicians that refer patients here. So I think that gives us a unique opportunity to help people.